here in UK, what has been happening is one day I was browsing through the social media and I came across a lovely pair. And also through my colleagues at the Blackpool Teaching Hospital, I came to know that there's a lovely couple who is trying to extend their helping hands to all the NHS staff members. And what was the unique thing about it is they are helping them with the transport. And as medical professionals, we are able to understand the transport, especially in the corona situation, is very important because if the social distancing parameters are not uh, well maintained, otherwise crowding happens, the transmission rate, which is expressed in terms of R number, can be affected, and also the newer cases of the corona can also increase as well. So let me try to introduce to you the wonderful lady, Babe Kinnon, and of course her lovely husband as well, who all have been working together about this project. So, Bev, would you like to introduce both of you kindly, please, and tell us something about the project? Did it start?
Okay, I'm called Beverly Kinnon. This is my husband Francis, and we started the project in the garden one afternoon after I just made a comment that perhaps through the lockdown we need to get a bit fit, and we sort of chatted about that and had a laugh. And so Frank got his bike out and sat in the garden with a glass of wine, which is not great for being fit, I suppose. And he was messing about with the bike, and then my son came round, Benjamin, and he sat in the garden because we've got quite a big garden behind us. He sat in the garden and started messing with the bikes, and then it was just like a light bulb moment for us all, really, that fix your bike, didn't you? You wanted to get fit and everything.
Yeah, we realised that we were quite good at fixing the bike, and we thought at that point, obviously there was an awful lot of emphasis on the NHS and transport and travel, and we just decided that we would offer to repair bikes free of charge for NHS frontline staff. That's how it started, and we put it on social media, and pretty quickly, within maybe 2 days, we had a garden full of bikes.
Yeah. And it was in my lounge, and it was in the dining room. There were just bikes on my settee. There was bikes everywhere.
Yeah. So we quickly outgrew our home. Within a 48-hour period, we'd outgrown the home.
Yeah.
And we got a bit worried because we didn't know what was going to happen from there. And a local church offered us the use of their building because they weren't able to hold their meetings, and said, why don't we use the church as a workshop?
Yeah.
And that's how the journey began.
Wonderful. That's indeed really a brilliant and such a nice thing to know. As they say, the saying is, every humble thing has a very small beginning as well. So can you tell us, like, when was it? Because we, being in UK, we are aware the problem which everyone, in fact, has been happening or going through, especially since the March days. When was it actually like?
This started.
It was about mid-March, just when Boris had announced the lockdown, wasn't it?
It was about 12 weeks ago.
Wonderful.
We'd been at home for 2 weeks.
Not that long, probably about 10 or whatever.
Yeah, maybe 10 weeks.
Yeah.
We'd been at home for about 2 weeks, and I work away from home normally, so for me to be stuck at home for 2 weeks was quite strenuous. And it was just amazing how being able to do something that's got us out of the home, because the weather was fantastic. So we were able to work in the back garden, and then we were able to work outside at the local church, the church building. So normally I'm quite pasty skinned, but we've been able to get a suntan and everything from it. So.
I remember one morning when the lockdown had just been announced, it became an almost ritual for Frank and I to get up and come and put the TV on and what's going to happen today, how many's died today, and it was becoming a fear thing for us to come down and see what else has happened today. Oh my gosh, what's going to happen today? And this really saved us it saved us from just sitting in front of the TV and worrying and not wanting to go out the door and not helping others and being out in the community, which has actually been a blessing, a real blessing to us. The amount of people that we've met through this has just blown our minds. It's been amazing, and it is amazing.
Yeah.
Normally, in the medical field, what we are learning as well, and even globally, people are complaining that during Corona, people are getting separated or getting away from the, due to the social distancing from each other. But there are wonderful people like you guys who are trying to do wonderful and noble initiatives like this, in which you are trying to not only bring the people together, in fact, literally bringing the society together as well. Now, about your professional background, would you like to share some details about your professional background as well? What you guys have been doing on a normally basis, and how, of course, you currently as well, just to be able to help some of the people as well. Now you're doing with those bike
Well,
repairs.
you normally work away, don't you? From I've had 3 children, and I've sort of brought them up at home, being a mum. Really, I've not really, I'm not sort of been a big career person. I've always stood by my husband and been there so he can work away, and kept us in a really nice lifestyle. That the children have had holidays, and which is very privileged to have a holiday, things like that. So I've just been a housewife really at home. But you've always worked away, haven't you?
Yeah.
And so when the children all went, moved away, I went into care work. So I nursed my father for 5 years, and he lived with us, and then he passed away. So I went into care work, so sort of in the community, giving help with that, because it's just on my heart to help, to be there for people.
I always say it like this: if you can recall as well, the one of the most toughest jobs is of a homemaker, and being a mother is a responsibility of 24 into 7 into 365 days, without any holiday, without any payment and all.
Yeah.
A big salute to
I hear
people.
you.
A big salute to, and really, I have all my heart out to people like you, who take care of you, of course, the family, the kids, and the husband and all as well. Without ladies like you, lovely ladies like you, a house is next to nothing. So now coming to the next thing, like, I know this has been a very innovative approach as well, and even the health secretary has been trying to stress on, especially the usage of biking as a preferred way of transport, especially during these corona times as well. How it has been able to impact you, and according to you, for example, when you took this initiative to be able to help NHS, how do you think that it is being able to impact you? I can understand even for you it's not easy trying to contact the people who are donating the bikes. They're trying to get through those different resources to be able to maintain those bikes as well. Can you please share some of your experience as well about that?
Been easy.
It's actually has been surprisingly easy.
It has.
One of the things which I think has enabled us to be where we are is transparency. So there's a lot of trust involved when we were going onto social media and inviting people to drop their bikes off for repair. We then had people coming to us and saying, well, I've got an old bike which I don't use that's in need of repair. Would it be any good to you? And so we then organised, with the help of a local logistics company who gave us a van and a fuel card to use. We started collecting bikes, and they came in all sort of shapes and sizes and states of disrepair. But as we delivered the bikes to the NHS workers, we would take a photograph of the bike being delivered with the ID badge for the NHS, and we would post that on social media. So people would see where the bikes were going, so they realised that it was genuine.
Right.
And then, quite amazingly, if it hadn't been for lockdown, this project would never have worked anyway, because people then had time to go into their garages. People were spring cleaning all through the lockdown. And they were coming to us, and they were giving us bikes that were new, bikes that were old. And this is at a time when there was an acute shortage of bikes in the bike shops.
Right.
So the whole thing has been, I believe, successful because of trust.
Yeah.
Because people trusted us to pick up the bikes, to repair them, and to give them to the NHS.
I think one thing as well, though, because we started this on Facebook, I mean, a lot of people do trash Facebook, but for this, it's been a really helpful tool, because I've been on Facebook about 15 years and I do have some credibility as a woman. And I think, you know, as a person, as Bev Kinnon, and I think that people, because I was putting it out there, know that we're honest and good-hearted people, knew that we weren't doing something, you know, out of the order, you know, wrong or whatever. So it just blew up. It got shared and shared and shared and shared, and now we've probably got about how many bikes?
We've delivered 83 bikes to date to NHS staff.
That's picked up, refurbed and delivered.
And we've got around about 130 bikes still waiting to be repaired.
Wow. Wow.
And we also have a children's bike project where there's a lack of response from the NHS for children's bikes, but the children's bikes that we're receiving, we're refurbishing and giving them to care homes and foster homes. So everything is being recycled and regenerated.
What we didn't actually know was our local MP told us, which blew me away actually, that some of the smaller bikes can go to carers who actually care for the parents that are still young children themselves. So they don't have a normal life. They are looking after the parents at home. And for a carer to be only, say, 10, 11 years old, to get a bike would change their life. You know, it'd be quite amazing. So we are looking into that. There's so much more we could do. So much more we could do if we had extra hands, of which I did put a call out the other night for extra hands, because we are desperate for help.
No, sure. The kind of volumes what you have been talking as well, it's pretty huge and definitely highly commendable as well, and no doubt about it. Like even from the city and whoever is going to come across this project as well, not just appreciates your initiative and kind of the work as well, what you have been doing is really amazing indeed, no doubt about it. Thank you guys for such a really wonderful initiative, in fact, at all. And would you also like to comment about your journey? For example, what were some of those best moments or some of those worst moments during the journey when this project started, and how it has been going on?
There's been
there's been loads.
There's been lots of best moments, not many worst moments.
No.
The thing is, my wife and I both do deliveries of the bikes, and
well, Frank drives the van, and I sort of do the
route planning.
Yeah, the route planning and things like that. I think that's sometimes where we've sort of butted heads a little bit. Well, we should have gone down that road. No, we should have gone down this road. Apart from that.
I think the best moments are, one of my best moments really was, there was a young lady who was working on the frontline COVID-19 ward, and she was having to go to work 2 hours early because she didn't drive, so she would go in with her mum, who was also a frontline nurse.
She was called Millie, wasn't she?
Yeah, and she had to go to work 2 hours early. But also when she finished work, public transport had stopped. So not only was she working an extra 2 hours, but she was having to walk home because her mum had gone home 2 hours earlier. And just to see the face when we delivered the bike of both the mum and the daughter was awesome.
It's called Millie or Molly.
And, yeah,
I'm not sure, Millie or Molly.
And
yeah.
it was such a shame because a few days after we delivered the bike, we heard that her mum had contracted coronavirus.
We're so sorry.
But she's well now.
But she's come through it and everything
yeah,
else.
She's well now. But I think my best there's so many best moments, but one of them was, well, I'll just tell you two quick ones.
Yes,
The
please.
first one I'd say was we'd had an afternoon where we were delivering vans, and we were quite bags. Vans. We're in the van delivering bikes. We're quite tired. We got to the last one. We got back in the van, and all the bikes had fitted. Because when I go on the list of people, we've been doing it by date. So when they contact me, I will then look at, say, the 11th of May, how many contacted, 12th of May, how many contacted, 13th of May, etc. So when I pick people out, I try and match them with what we've got in the workshop, height wise, build wise. It's no good me sending 10-foot bike, somebody's 2 foot just wouldn't work. Do you know what I mean? So I try and match them. So that afternoon, every bike fitted everybody that we took them to, and I got back in the van and we did a high five in the van. It was like, right, let's get home. Yeah, it was just an uplifting moment. That had been quite a tough day, you know, logistic wise, and we're in our 50s, you know, so it's not easy when you sort of get middle-aged. So, but another moment is a young girl who'd had a fire in a house, and she'd lost everything, and she was put up by the nurses' home at the Blackpool Victoria. And when we turned up with a bike, we told her we got a bike for her. She just couldn't believe it. Tears, and it was just, you know, it was just amazing. A beautiful moment to see.
No, brilliant. I'm sure you are one of the key as well to making many, not just beautiful stories, but also beautiful experiences as well for a lot of these people who are trying to give the good quality healthcare to the people, especially in dire times like this in Corona. Thank you again for sharing all these beautiful experiences. And I'm sure you will recall very well that our local esteemed MP as well had appreciated your efforts and all as well. When did you come to know about this, and how did you feel? What was your reaction about that?
Well, one of the things which has been really important for us is supply and demand of bikes. So we were getting to a stage where we didn't feel we had enough bikes in the workshop for the demand that was required. And I decided to contact the local MPs for both Fleetwood, Blackpool North and Blackpool South. And it happened because we've outgrown the church building. So we now have an old hospital ward in Fleetwood Trust Hospital, which is our second workshop. It's ironic that it's a hospital, isn't it? But as a result, we were introduced to Kat Smith, who's the Fleetwood MP, and she said that she couldn't really help us in our Thornton building, that we needed to speak to Paul Maynard. So I contacted Paul Maynard's office and just really said to him, look, this is what we're doing. It impacts NHS. It impacts the safe travel for staff. It impacts the carbon footprint.
Yeah.
It impacts recycling. But most importantly, health.
Mental health as well.
The mental health side of things.
Huge.
And he didn't really have much of a choice but to meet with us because we were in his constituency.
You bombarded him with emails though, didn't you?
Yeah, he said he was getting fed up with me emailing him because I just emailed him every day and said, hang on a minute, why have you not been in contact? And as a result of that, we then we've been in communication with Scott Benton, who's the Blackpool South MP. And we're just saying to him, look, the government is saying we need to get on our bikes. The government is saying support the NHS. Yeah. The government is talking about our carbon footprint. We believe we tick all the boxes here if you would just come and meet with us and see what we're doing. And that's how the meeting with Paul Maynard happened. I think it was just to stop me emailing him.
I must say as well, so I was in Netherlands from 2010 to 16 when I was doing my PhD and also further training about the heart arrhythmias. And that's how I got further infatuated with the passion of biking. And so since then, biking has always been something close. and working as in a department of cardiology, I must say, as you rightly summarized, about the benefits of biking is immense. Not
Yeah,
just it is wonderful for the health of the person as well, but also for the economy or the nation as well. And I'm really glad our health secretary has been trying to implement those things as well.
yeah,
And people like you, who are the social transformers, are trying to really help, even in times like coronas as well, which during which a lot of times people may think like, what can be done in corona? Nothing can be done. It's so difficult and all. But you guys have again proven a very valid point. If there's a will, there's definitely a way.
yeah,
So uh, the good news has been what has been happening as well is like the corona, at least in the first phase, the number of infection rates has been coming down. Things are becoming
Praise the
better.
Lord.
And so what is your experience? So for example, uh, uh, do you think that what are you do you have any future plans as well about your wonderful initiative and your wonderful plan or
Yeah.
project?
yeah.
Yeah.
Well, when we started Bikes for Heroes, it was based on the fact that our heroes were the NHS. I have a personal, well, we both have personal experience with the NHS, but a couple of years ago, I was diagnosed as having cancer of the peritoneal with an unknown primary. And miraculously, I came through it with no problems whatsoever. And that is thanks to the people in the NHS who looked after
Yeah.
me.
Mhm.
And so they are our heroes. You are our heroes. But we realised that Bikes for Heroes doesn't, in the future, doesn't only mean NHS workers.
Mhm.
Yeah.
There are heroes everywhere,
Sure. Sure.
and
Key workers as well and people like that, isn't it?
every day we hear of situations where people have a need, a dire need, or
Yeah.
they're not appreciated for the things that they do. And we believe that Bikes for Heroes will continue after this particular situation with coronavirus. We believe that there will always be heroes in need of bikes, and there will always be heroes that want to help those individuals.
Mhm.
So we'll simply be there waiting for the call to pick up the bikes, and we'll ensure that they're delivered. But you are our heroes today and tomorrow, but there's more heroes coming tomorrow, we believe, anyway.
Heroes are the people who are created by people like you and us, in fact.
Yeah,
And everyone is a hero, I would say.
that's
People
right.
like you who are trying to help the society, strengthen the people like you who are trying to strengthen. It's people who are trying to strengthen it further as well. So it literally becomes like a vicious cycle. One
Yeah,
giving a helping hand to someone, someone else giving a helping hand to other person as well. And I must say as well, I worked in Germany as well. I worked in US as well, in India as well, and also in Netherlands as well. And I must say, NHS has been a great system to be able to work over here. And frankly telling, the kind of admiration which is there, especially from people like you and all, it's amazing. And no doubt about it, the kind of difference, how it is able to contribute to the quality of life of
yeah,
the whole environment and also the citizens of the UK and also the people who
Yeah.
are getting across it as well. It's amazing. And
Excuse me.
kudos to people like you who are trying to strengthen this bond of sharing, taking care of each other as well. It's even more amazing. And there, as you rightly said it as well, the heroes are not just the people who are working for the NHS. Heroes are is everyone. It includes everyone who's trying
Yeah.
to make the society a better place to
yeah.
live,
I agree with you.
to give a helping hand to each other as well, and to, as I said it, on an overall basis, society who is trying to make it a better and to help it go further and further as well.
Mm.
Frankly telling, I really loved it, and I have been really curious to know about it, and I'm sure there are a lot of other people as well who are curious to know about the wonderful initiative which you guys are doing, in fact, as well. Thank you for sharing all your insights. And I must say, I would say a heartfelt best wishes for taking care of this innovative project and doing it so well. Thank you so much.
Thank you for what you do.
Yes, thank
and
you.
to all the people you represent, because it's a team effort, and without people donating, without people being able to receive the bikes, there would be no project. But we are so blessed to be able to be part of it.
Yeah, it's helped us doing it, as well as it's helped people that have received the bikes. It's been a blessing for us, hasn't it?
Yeah.
Yeah, to meet loads of new people as well, and to hear their stories about what they're going through. And it's very uplifting, as well as very emotional and moving. It's been quite emotional, hasn't it? I've bawled my eyes out at times.
Yes.
It's been brilliant.
Yes. Well, no